Just be honest with them. Start turning their dials. Start pushing them, motivating them, doing something greater than just being a rehab technician for a specific joint. You're more than that. You're more than that. And that's Hi everyone, welcome back to the podcast. New listeners, welcome to the world of the sports world of physical therapy, and returning listeners, welcome back. This is a great topic today that I just came off of a session with a client, and it is a very important topic that I think a lot of therapists come into, regardless of the stage of practice. And if you're a student and you're listening, you're going to run into this. If you are a new grad, you're going to be running into it often. And if you're an experienced clinician, you've been battling with this. What is it? Before I go into the topics, a little housekeeping. How is life? What's going on? Life is good. I have a couple different projects going on. At the moment, I'm starting to gather some more interns for the mentorship side of the business, and trying to expand and grow our reach to be able to help more clinicians like yourself. Let's see what else. I have a small weekend getaway coming up soon. Excited to do that with my wife and kids. By the time this podcast comes out, all right, let me do this here, because I don't know if I've ever done it on the podcast yet. I wanted to announce, if people didn't know, anybody's in my world and they didn't know, we're having baby number 3. I haven't really published this, on media or anything else. Generally, I'm a private person, but I understand that things like this, people will eventually find out. But we're having baby number 3 in June. I'm really, really excited. So I'm not sure when this podcast will come out, but it'll be sometime before then. But yeah, we're just preparing and planning for that. Still thinking of names and everything behind the scenes. So anyways, that is what's good in my life. All right, moving on. The topic today is what to do with patients or clients, whatever you call them, after they're pain-free. In our world of rehab and physical therapy, there's a term that I really have a hard time with, and it's called discharge. And typically that's the next stage, right? So most of us think, well, I got them pain-free, I did my job. You're on to the next. On to the next what? Who's the provider? Who's the person that's going to help them? And this is a common question, like, what do I do with them after they're pain-free? Like, I did my job. That's assuming that they're going to be pain-free forever. And I don't know about you, but I've never met a clinician who can keep somebody pain-free in one episode of care for their whole life. And what I mean by that is, yes, you've got 0 out of 10 pain. Love it. But it's going to come back. It always will. Unless they're dormant and they don't exercise anymore. If that's your patient population, good for you. You're probably not on this podcast. But if you're on this podcast, it's because you have active people. You want to work with active people. You love working with the person who strives to do more, and they're actually just a replica of you. Like, they want to be the best. They want to be successful. They want to pursue something bigger. They don't want to just like do the treadmill 2 times a week. They want to like train 4 to 5, 6 days a week, a little bit of cardio sessions, a little bit of anaerobic threshold, a little bit of strength training, a little bit of running, a little bit of like abs, core. They just can't turn it off, just like you, actually. So the so what do you do? And I had a great conversation with a client who I've been seeing a little under a year now, and they've been pain free, and they really don't have any aches and pains anymore. Small things. So it's not really pain. It'd be more in like the wellness territory. So what do you do with patients after they're pain-free? How do you manage them better? Well, you got to figure out, before you start telling them what to do, you got to figure out what you're doing for them. Like, why are they even seeing you anymore? And it's your belief, your confidence in what you're doing for them that's going to help to set the next stage. So if you don't believe that after discharge people stay pain-free and they're going to live in this like la la land, that they're going to be pain-free for the rest of their life and they'll need your services again, I think that's naive. I think that's really hard to believe. People will always get hurt. You and me will always get hurt. But the difference is people come to you for three things: education, motivation, and accountability. You guys, whoever you are listening here, whether you're a student, you're a novice, you're a clinician, or you're experienced, you are studying to have this knowledge. You will have this knowledge, or you already have it. And now you're just adding layers onto that. So the difference is you don't have to seek help for the need that you have because you know how to manage it. That's like a financial advisor. No, like they don't need to seek out help from another financial advisor because they kind of have the basis. But you might because you have to pay off loans or student debt. So you need their services. And just because you stay on and you ask them for a one-time consult on what you should do for your student debt doesn't mean that you won't need help once you're out of debt. Now what? Where do you start to divvying your money into your first home? Do you start with buying a condo? You need help along the way, and so do these individuals. And the problem is, I think that we as a profession don't see it that way. We see it as we did our job in this narrow window of life, and that was to get them out of a hole. Meaning, if their baseline is zero pain, and when they get pain, they actually stop exercising, that's where we help them pick them back up to baseline, and then we have to wait for them to come back down. That's the way I see it. And if that's the way you're going to treat, it's whatever fulfills you. What fulfills me is keeping people healthy and active, like forever, like their entire life. I love it because I think it's valuable. And I got this framework. If you haven't heard this podcast from mine, I got this framework from working pro sports and watching these athletes. I thought I can get somebody pain-free in one session, and I could, but they'd go and mess it up tomorrow, and something else pops up. And I realized that humans, we do the same thing. Insurance has always been the barrier. But if you allow the patient and client to understand how you can get them that way, that's where it comes from you. The patient and client will hands down want to stay as long as there's value. And so when you are getting them pain-free and you're like, I don't even need to do anything anymore. Their knee's going to really, that pain's not going to come back. Here are a couple things I want you to consider. When that person, and now I'm assuming that you believe that keeping people healthy is a good thing. If you think that getting people pain-free is a good thing, good for you, but that's just stage 1A almost, before there's like 72 steps to keep them out of pain. So as I was seeing this client today, who I've been seeing less than a year, we were talking about, you're out of pain and we love it. His question was, how do I keep this away? And I was like, that's a beautiful question. There's three things that I currently, in my practice, I've changed this every single year. And that's a great thing. It's adapting because every year you learn more things. You listen to podcasts, you meet more people, you read more books, you take Con Ed courses, and you're always adapting your philosophy. So currently, at the time of this podcast, there are three main ways that I'll focus in on keeping them out of pain. And the first one is probably the most obvious, and then ones that you probably consider the most, and that's exercise. This person asked, their daughter comes to see us as well, and he asked, hey, how's my daughter? I said, it sounds like she's continuing to ride this wave of ongoing pain. It feels better, it feels bad, but he says, okay, what's the root? I think I said I'm confident actually that the reason why his daughter is not accelerating the way that I think she could be is because she's not consistent with her strength routines. She's a runner, has a little bit of neck pain, a little bit of mid-back pain. And this person doesn't do a lot of resistance training or corrective exercise, so just tissue work based. So if you do, foam roll, lacrosse ball, massage, those are all really good to the tissue. I think that there has to be some type of glue to keep that nice and tight. And that's why I think general strength training is massive. I think more literature is coming out, just like strength to body weight ratio is massive. Just general strength. And we can go on to all the small details of like, is it like, high intensity? Is it tempo based? Is it body build? I don't care. Just have them pick up something that has a larger load and it goes in a routine that works in the directions of the muscles to get them stronger. I don't care. I'm not about the semantics, but I will say, I know that if I can get somebody pain-free, the first start to kickstart all that to help that stick is going to be a strengthening routine. And I don't care if they're a runner, if they're a rower, if they're a fisherman. I need some form of strength because they need to be able to lift their body weight, or 3 times their body weight, or 6 times if they're a runner, now going larger times their body weight. I need them to be able to sustain that. And it has to have a little bit more rigidity to it and stability. So I don't want to talk about corrective exercises. You figure those out. I don't want to talk about specific exercises. You figure that out. It's the principle and the concept of the philosophy that you have to get people stronger or flexible. I don't care on your philosophy if you're like, it's not a strength thing, it's a flexible thing. Cool. Just have them move more than they were doing before. That's all I'm saying exercise is. Move more than you normally do. So if you sit all day, cool. Just move more than you do. That's exercise. I strength train 4 times a week. Sounds good. Move a little bit more in the way of yoga, of the strength training, of recovery, of whatever it is. I don't care. Just move more. All right. So if they're strength training and you've got them down, we've talked about this before. You need a two days a week is just bare minimum to sustain like bone mass and strength over years. So they need at least 3 days a week to have a stimulus. Okay, 4 days is beautiful. 5 days would be ideal. Sounds good. And then the other 2 days, insert them whatever day of the week, or if they're on a weekend, sounds good. But they have to have the strength training. If they don't, I call it like a painting. Anytime you're working with somebody and you like work on tissue work and you stretch them and you get them strong, like all you're doing is like you're just painting this beautiful picture. And then they don't follow up with exercise or anything else. That picture just gets messed up. Just don't mess it up. Just continue doing exactly what you're doing. And if they fall off that wagon, the answer is not always like more tissue work, more anything else. It's getting them on a routine so that they understand that is the base. If you want tissue work and everything else, the base is going to be strength or some type of exercise or fitness. Just do that. So now, if a client is out of pain or a patient is out of pain, and you've got them to a point where they're actually training more than they used to, sounds good. Now they're like, man, I feel great, fantastic. Don't discharge them, because here's the next layer. Once that's strong, here's what I would love. In 6 weeks to 12 weeks, you're going to fall off, just like every other human, just like you, just like me. We're all going to go through these waves of commitment and dedication. So once that comes on, I would do checkpoints. I always tell them, like, listen, here's what's going to happen next. You're going to fall off. You're not going to be committed. I want to see you in 6 weeks or 3 months. And because I know life happens, I need you to stick to this. Do not change it. Do not cancel it. I don't care, because it's great for the greater good. And then we'll review what to change up on your next program. That is called, checkpoints, or doing mesocycle and microcycles in a strength training routine. That's all you're doing. Quarterly checkups, quarterly reviews on how your performance is doing. At Sports Performance, we do it here as a team to make sure that we're all on the right track as a company and as individuals. And it's the same thing that we do with our patients and clients. It's just make sure they're on the right track and they stay there. And if you think that getting them out of pain is the reason why they came to see you, I think you're missing out. They came to see you because they wanted something more. They wanted some help beyond that to help them do something greater. I've said this before. We all have pain, but not everybody goes to see people for pain. And the ones who do are looking for help to find something bigger to accomplish. I don't care if it was reaching the cabinets to be able to drive without pain, but that wasn't the only pain. There's other things beyond that. They can't sleep. We all seek out help for things that are detrimental to our current lifestyle. And most of the time it's literally the exercise and fitness routines that they want to get back to, the patients and clients that you and I are seeing or you want to see. So number one is I think about these as dials, either on an airplane or you're just turning dials. You're looking at a dashboard and you're just like turning little dials. So if they're out of pain, my dial for strength training goes up, or exercise in general. Perfect. I need you to keep that. So now, next question is, well, Chris, what about the people who are already exercising and they already have all this? I have a CrossFitter, I have a sprinter, I have a marathoner who's training 6 days a week. Okay, perfect. Let me introduce you to the other dials that I'll use. So number one is exercise and fitness. I have clients who are sitting on a bell curve. 10% of these are pro athletes, 10% are community members who are just starting, never exercise, and they want to get out of pain, but really they just need more movement. That's going to solve their problem. These people over here who are pro athletes just need less movement. I need to bring them down. They're already training 6 days a week. I don't need to do more. These people over here don't exercise at all. I need to get them up to 3 days a week minimum. Ideal world 5, but that's going to take me about 9 months to a year to get them up to that point. Everybody else in this 80% is exercising 3 to 5 times a week. They generally have a good knowledge of like how to maintain themselves and do those things. So where are they on the bell curve? So first dial was strength training or workout or fitness wise. Perfect. Now, if you have a client or a patient who has a lot of, who's already is working on that dial and they're pain free, next there's two other elements, two other main dials. One is nutrition. And you don't have to be a dietitian to be able to give people like a basic framework, like how often do you eat? How many times a day do you eat? Do you track anything? What's your water intake? How often are you drinking water? All these questions just stimulate awareness. On this last podcast, I talked about this. Knowledge is not power, awareness is. We all know that water is good for us, that we all know that eating 5 times a day is better than eating 1 time a day, right? And I don't want to get into that debate. But I will tell you this. If somebody reminds you of that, you're like, oh, yes. So knowledge is not power because we all know it. It's awareness, like somebody bringing it to your attention constantly. Like, you're right. I haven't taken a Con Ed and shoulder stuff. I need to go back to my notes, or I need to go back to stuff. All right, there was a good course I took a year ago. I need to go back to that. It's not that you didn't have the knowledge, your awareness, like bring it back up to the frontal cortex. Let's bring it back up. And sometimes clients need that, and patients and clients need that. Like, what else? So if your exercise is great and you're now pain-free, here's some elements to think about. How's your nutrition and what do you need to clean up? Because that's going to improve your repair process. We know that. What's your protein intake? How many liters or ounces of water are you drinking? How many days a week? And then are you tracking anything? Are you looking at macros or your calorie counter? I just need you paying attention to something else that's not just exercise, because ultimately we need the repair process to happen. And if you have a dietitian or nutritionist that you partner with, perfect. Put them together, like just connect them. And what you're doing there is you're building a small mini community of people who are trying to help people stay healthy, which is what you are. You're just helping in a specific phase. You are not a pain management specialist. Let me tell you that. You are somebody who can see anybody along that spectrum, whether it's acute injury, subacute, chronic, post-surgical, wellness, strengthening. You can see them along the whole spectrum. If you just want to specialize in pain, good for you. This podcast is way more than that. It's for people who want to see people along the whole spectrum and they want to improve lives, not pain. There's a very different world you live in. If you want pain, good for you. This podcast is not going to resonate as well with you. There's nothing wrong with that. But for those who want more, and like I know I can get them out of pain, that's the easy job. Next, I want to keep them out. I know that I can make a difference in their health. Because if you get them out of pain, you didn't solve anything in their health. You just got them to like above baseline again. And you're assuming that they know what to do. So now, one dial is strength training and fitness and exercise. Turn that up. If they already have that up, sounds good, pain-free. Turn up their nutrition. Make sure that that stays pristine, or connect them with somebody if it's an important part of their recovery. And the third part, like let's assume their exercise controlled, nutrition is pristine, and they're pain-free. That's a bomb waiting to explode, because they're sitting high and mighty. That means that if somebody has zero pain, their nutrition is good and exercise good, they're just going to keep turning up a notch in intensity or days because they're fearless. They think they're on cloud 9. And they've earned it because they've put a lot of time into training, into nutrition, into, staying pain-free. Great. You've earned that. I still serve a role. What dial can we be missing? And that's a recovery process. So the client I saw today, we were talking, and this is his scenario. He's training 5 days a week. He's over the age of 50. Very, very fit. Buys, organic, whole food products, believes in, health and wellness, takes meds, takes vitamins, takes supplements, high on his protein, gets his blood work done every quarter, and he's pain free. Okay, so then now you have to ask, like, what are you going to do with this person? It's just a pro athlete who's training regularly, and now you just want to keep him there. What's left over? One more little dial, and that's going to be your recovery process. So, uh, you know, when you look at research for recovery, I'm talking like Epsom salt baths, I'm talking about cold plunges, hot tubs, saunas, sleep, all these things. You're talking about just 1-2% increases, right? And you can read all the research you want. I'm not trying to debate whether one is better than the other. I'm just saying if you're looking for an edge, 1%, 2%, 10%, 5%, just something to add on to the current portfolio for this athlete. If they're pain free, it's good. If they're strength training or they're working out and their fitness and their routine is solid, great. And their nutrition is perfect or pristine, you got that under control, add the recovery process on top of that. Just having them aware that they can be adding other elements to this. What do I say? I usually say at least 2 days a week of some form of active recovery or passive recovery. One full day of passive recovery, and that's just like, lounge on the couch, do nothing in Netflix. Like, you need a passive recovery day where your mind and body is shut down. Then you can do an additional 1 or 2 days of active recovery. What I mean by that is an Epsom salt bath for 20 minutes, a cold plunge for 12 minutes. That's rough. Like 50, 55 degree water. Contrast baths, so hot and cold. If you have access to, like a hot tub at home, and you buy one of those bins to be able to put ice in. And then one hack that I've seen, and somebody posted this on Instagram, and I loved it. It was don't you dare get mad at me for this or point fingers in my direction. They used like a commercial freezer, or like just an isolated freezer that you can put in your garage, and that's plugged into power, and they just filled that with water at cold temp and above freezing. And that's an easy way that you don't have to buy ice every single time. You're just like chilling the water every single time. But don't, yeah. Anyways, so cold plunge, hot plunge, Epsom salt baths, and the most critical is sleep. This client of mine that I said this morning, his dial needed to turn up with sleep. He even had, if you're an Apple Watch user, or if you like the app or the product Whoop, WHOOP, that is a great product for analytics, like data-driven people. This person happened to be an accountant, so this person loves numbers, and they love the Whoop, which is like a wristband or a band around the arm or around the wrist, and it just measures your heart rate, it measures your sleep. And I'm not endorsing it. I have no tie to it. I'm just giving an example. There's lots of other products like this. So what do you do with this product and this data? It just helps you better understand like the quality of your sleep. So this person's resting heart rate was like 42 at night, and they can get 2-3 hours of REM, 2-3 hours of deep sleep, and but they weren't. They're only getting about an hour, so they were tossing and turning, and the total time that they were in bed was 8.5 hours, but total time of sleep was 6.5. So somewhere in there, they weren't getting good quality, whether it was a phone or whatever it is. And so I said, if exercise is great, that dial's turned up, we're good. They're pain free, and they have turned up the dial to nutrition. We've focused on general nutrition maintenance, and they're working with somebody, a dietitian, to make sure that that's controlled. So we have those two dials. So now when we look at recovery, the recovery process is, we noticed that his total sleep was low. His quality of sleep was low. His total time in bed was high. So he thought he was actually being productive, but in reality, he was just getting lost in, Instagram or his phone and watching TV. So actually, his total time in bed was a false positive. It looked like he was actually in bed, but if you look at his heart rate, it wasn't coming back down because he was not in deep sleep, or actually he wasn't even close to REM because his brain and everything else was going on. So recovery mode wasn't on yet. So the total time that he had potential to sleep and recover was wasted on, blue light. And ultimately, we discussed what the next step for him. And for this person, it was shut it down. So we worked on, if you know me, I love apps in the iPhone to make sure that it just maximizes day and your day and organization. So we worked on an app that shuts his phone in like bedtime mode 30 minutes before he wants to go to sleep. So what will happen is it'll shut down his apps or apps that he knows he'll go into and get lost. So it can turn on one other app, one main app, which is his audiobooks or his like Kindle version. And what that allows him to do is just focus in on being present for and not avoiding getting lost in the phone. And so we set it up that way so that way he can have at least 15 to 20 minutes of reading, whether that's a hard copy or through his phone, and then everything else shuts down, right before he wants to go to bed. So in that case, everything's shut off, TV's off, phone is off, and that allows him to get the deep sleep that he needs or push him in that direction. So he knew this was good for him. He had the knowledge. It's not power. Awareness is. We just brought his attention like that. You were just missing the components to shut it down early. You're losing 2 hours of potential sleep when you thought you were doing it. So you just had to make a change. And that to him was a big light bulb moment. Every client that comes to see me, we have to work through what dial is off. And if your client or patient was trying to exercise and they're trying to lose weight and they had knee pain, and you just solved the knee pain, guess what? It's going to come back because they have to get back on that journey to lose weight. And we know losing weight will help decrease knee pain, but the problem is, in order for them to lose weight, they need to exercise and do some general fitness on top of their nutrition. So getting them pain-free solves nothing. Keeping them pain-free along that journey until they hit their marker of weight loss, now you've done your job. Now that person, if they've lost their weight and they didn't have any hiccups with their knee, great. Now what? What dial needs to be changed? They're pain-free. They're exercise and fitness. Now we can maybe upgrade that a little bit more. They were doing 4 days a week. Now let's go 5 days, but now break it apart. Let's do 2 days strength, 3 days cardio, whatever that is. Have an active recovery day. Just start working on your nutrition. Have them work with a dietitian. And when you have this, you're assembling a team, just like pro athletes. And that's what we do. Like that is what we do at Sports Performance. That's what we do for people. And if you think that discharge is like it's your proudest moment ever, it was an opportunity to help somebody, and they didn't know any better, that you can help them more. And I tell people this: just to start, helping them with dials. Like where can you add? Where can you change and upgrade? People need it, but you got to believe in it first. And if you're thinking like, Chris, you're crazy, you're going to be discharging like crazy. Good for you. But there's other people that you can help push towards a different continuum and push them to the limit where they're actually more fit, more healthy, eating better, sleeping more than they've ever done, and happier to have met you. And those are the clients that I serve. Like that, if this fires you up, good for you. I'm on cloud 9 right now because talking to the client this morning who is going over almost close to a year now with me. He said, I'm more fit now than I ever have, and I'm 50 years old. And he's invested in the Whoop. He's seeing a local dietitian. He's working on his blood work. He's like, I've never paid attention to my health so much. And all this started with shoulder pain. Why? Because I just took the pro athlete approach and put it onto a community member because they deserve it, but they just didn't know it was available. So what do you do with your patients and clients after they're pain free? Start turning those dials. Start pushing a little bit more exercise and fitness and health. Then start turning, once they have that controlled or they're starting to push that, now you can get the nutrition going and then make sure the recovery is going. And if you have all three of those dials, they're unstoppable. Yeah, you're always going to have traumatic stuff, people fall or ankle sprain, whatever. But I'm talking about atraumatic pain development. It's preventable. Just keep them under control. This is atraumatic management. If there's trauma, it sounds good. You'll always be that go-to person. But if you're looking to help people for life and really keep them healthy, and you would appreciate this. I give the analogy of debt because I know that a lot of new grads will come out with debt, and just when you get out of debt doesn't mean you're done. If you work with somebody to help get you out of debt, that sounds good. But the next layer is, how do we now prevent that from happening again, and then move forward with really smart decisions? And that's the same in any skill set that you want to develop. Anybody you seek help from, it's the same thing. If you get an oil change once and they're like, man, that's the best oil change I've ever done, you think you're never going to do it again? No, you're going to do it again in 3,000 miles or 5,000, whatever the number is nowadays. Just like this person, all you're doing for people is oil changes. You're a mechanic, and their legs and arms and body are like the wheels. They're just going to keep moving. And once they keep moving, they're going to break down. And just because you fix one tire or the shocks or the alignment doesn't mean it won't ever happen again. It's just wear and tear. If you can take that one thing from this podcast and from my framework and methodology, it's massive to change the way that you view on what you do for people. You're simply giving them oil changes, fine-tuning them, moving them. And just because you do one good service and discharge doesn't mean they won't come back. So you have to be prepared. If you love your job and you want to get better at it, start working on some of these things. It's not just about the Con Ed course for the shoulder and the knee, because all those do is just reinforce you being a segmented mechanic when you're just looking at keeping this vehicle moving. Not just ankle pain, knee pain, shoulder pain, back pain courses. Change your framework on how you view people. They love it, they need it, they deserve it. And if you can take this and change the people's dials, keep pushing them, they will remember you forever. Because no one in this medical world, you're so limited on time. You get 2 to 3 minutes with a physician, 2 to 3 minutes at a ER or urgent care, 10 to 15 at a PT clinic. No one's ever listened to these people and helped push them in the right direction. You know that they can go the wrong direction if they don't listen to you. Just be honest with them. Start turning their dials. Start pushing them, motivating them, doing something greater than just being a rehab technician for a specific joint. You're more than that. You're more than that. And that's what this podcast is about. So I hope that fires you up. It fired me up this morning, so I had to do it. So nonetheless, I hope you guys are great. I am really excited about these next 2 months and make my official announcement on what's happening with our family and our growing family. And excited to share that with you guys and the audience, and on to the next journey. I'm really excited about this, and really excited for the growth that is going to come with it. So, all right, guys, that is it. I will catch you guys on the next episode. I hope you guys are well and safe, and I'll catch you guys next time. See you guys.